You know, it's pretty wild to think that your own eyes, your fingernails, even the skin on your legs could be sending out secret signals about your health. Even something you might just brush off, like feeling anxious, could actually be your body trying to tell you that something is up with your thyroid. An overactive thyroid is way more common than you'd think, so today we're going to play detective and unmask the visible signs so you know exactly what to look out for.
All right, let's get right into it. Have you ever had that feeling where your heart is just racing for no reason? Or your hands have that little tiny shake? You blame it on stress, maybe too much coffee. But what if the real culprit is a tiny gland in your neck that's just gone into overdrive? That's the mystery we're going to solve today. So, let's meet the main character in this story, your thyroid. It's this small, butterfly-shaped gland right at the base of your neck. But seriously, don't let its size fool you. This thing is an absolute powerhouse. It's the master switch for your entire body, controlling your metabolism and affecting pretty much every single cell you've got. So how's it all supposed to work? Well, your body has this really elegant feedback loop. Your brain sends out a little signal, it's called TSH, which basically tells the thyroid, hey, time to make some hormone, which is T4. Then, the brain keeps a close eye on those T4 levels. If they get a little too high, it just dials back the TSH signal, kind of like turning down the volume on your stereo. It's a perfect system when it works. But that's not the whole story. That T4 hormone gets converted into the real active stuff, T3. And you can think of T3 as the gas pedal for your entire metabolism. It's what tells your cells, okay, let's go, time to burn some energy. When it's all balanced, life is good. But what happens when that perfect system gets, well, hijacked? The number one cause of an overactive thyroid, or hyperthyroidism, is when your body's own immune system goes completely rogue and basically starts attacking itself. And that brings us to the main culprit, something called Graves' disease. It's essentially a case of mistaken identity. Your immune system starts making these imposter antibodies that look exactly like the brain's TSH signal. They lock onto the thyroid and just floor that gas pedal, forcing it to pump out hormone nonstop. And at that point, the brain has totally lost control. So when your thyroid is stuck in overdrive, your body starts leaving this trail of clues. So let's start our investigation. We're going to look at the telltale signs that you can actually see, and we'll work our way from the top down. All right, first clue on our list, the eyes. This is one of the most common and, frankly, one of the most noticeable places to spot the signs of Graves' disease. We're talking about something called proptosis, or what looks like bulging eyes. What's happening is those same hijacker antibodies are telling cells to produce hyaluronic acid. Yep, the same stuff they put in lip fillers, and it builds up behind the eyes, literally pushing them forward. This is no joke. It can lead to double vision and even risk your eyesight. Here's a quick self-check. Go look in a mirror. If you can see the white part of your eye above the colored part, the iris, that could be an early sign. Okay, moving on. Next stop in our investigation, we're going down to the neck. Now, aside from the thyroid itself getting swollen, that's called a goiter, there's another really dramatic sign you might see.
It's a test called Pemberton's sign. Check this out. If that goiter gets big enough that it's actually dipping down into your chest, just raising your arms over your head can squish the veins that drain blood from your head. This makes your face and neck turn all red and your veins pop out. Then when you put your arms back down, it goes away. It's a pretty striking sign that something is blocking the flow.
All right, let's keep this investigation rolling. Our next batch of clues? They can be found right at your fingertips, literally. Your hands and nails can show some really specific signs of an overactive thyroid. First up, there's something called plumber's nail. Your metabolism is so fast that your nails grow like crazy, and they can actually start to lift up and separate from the skin underneath. Then there's clubbing. Try this. Put the nails of your 2 index fingers together. You should see a little diamond-shaped gap. If you don't, that's a red flag. But maybe the earliest sign is a tremor. To spot it, hold your hands out flat and put a piece of paper on top. If that paper starts to jitter, that reveals a superfine shake you might not even feel. And for our final external clue, let's take a look at the skin. Specifically, the skin on your shins can develop a very unique and classic look in Graves' disease. This thing is called pretibial myxedema. You know, doctors have this great way of describing it. They call it peau d'orange, which is just French for orange peel skin. And that's exactly what it looks like. The skin gets thick and waxy, and the pores look just like the dimpled texture of an orange. And guess what causes it?
that same hyaluronic acid buildup we saw behind the eyes. It's the same process, just happening in a different spot. So, we've looked at all these external clues, right? But the real danger, the real chaos, is happening on the inside. Having too much thyroid hormone is like your body's engine being redlined 24/7. It's this state of constant internal mayhem that you can't see, but you can definitely feel it. And this overdrive hits everything. Your heart is working so hard it can slip into a dangerous irregular rhythm called atrial fibrillation, which massively jacks up your stroke risk. Your metabolism is burning through fuel so fast you're losing weight even though you're eating all the time. Your body even starts breaking down your muscles and bones, making you weaker and raising your risk for osteoporosis. And your brain? It's basically stuck in fight or flight mode, which feels exactly like crippling anxiety, panic attacks, and serious brain fog. But, and this is a big but, here is the good news. This is a solvable case. This is not some deep, dark mystery. Doctors have really clear ways to crack the case, confirm what's going on, and they have incredibly effective treatments to get your body back in control and find that balance again. The diagnosis almost always starts with a simple blood test, and the results tell a super clear story. The TSH, that signal from the brain, is going to be really low. Why? Because your brain is basically screaming stop by turning its signal all the way down. But the T3 and T4 hormones are sky high because those hijacker antibodies are forcing the thyroid to completely ignore the brain. Okay, now listen up, because this is a really, really important tip. Biotin, or vitamin B7, which is in tons of supplements for hair and nail health, can totally mess up these lab tests. It can give a false positive, making it look like you have hyperthyroidism when you're actually fine. So you have to tell your doctor about any supplements you're taking, and make sure you stop the biotin at least 2 days before you got your blood drawn. So once you have a diagnosis, treatment is usually a multi-step plan. Step 1 is just getting those awful symptoms under control, and they do that with beta blockers. These things block adrenaline and can almost instantly calm down the racing heart and the shakes. It's huge relief. Then, while you're feeling better, they can move on to the root cause with medications that block the hormone production, or sometimes using radiation or surgery to shrink the gland down. And to figure out exactly what's going on, doctors can use this really cool test, a radioactive iodine scan. You swallow a tiny, totally safe dose of radioactive iodine, and just 24 hours later, a special camera can create a heat map of your thyroid. It shows them exactly which parts are working overtime, which helps them come up with the perfect treatment plan. When you really think about it, everything from the look in your eyes to the shake in your hands to that feeling of anxiety in your chest, it's all just communication. It's your body sending you signals, trying to tell you something. The real question is, are you listening?